Hello, my name's Kim and I'll be your Pilates instructor today. If you do feel pain, discomfort, shortness of breath or dizziness, or any concern about your vascular access, then please do stop and seek advice. However, if none of these things happen, relax and enjoy the movement. If you do feel concerned at all at any point, you may just sit down, find a comfortable position, breathe and imagine yourself carrying out the exercises that I'm describing. Okay, let's begin. In Pilates, we are aiming to work the deep postural muscles. They are everywhere in the body, supporting all of your joints, but especially around the spine. We think about these muscles as being like a corset that support the spine. The big movement muscles, we would like these to be working to move the body. If the deep muscles stop working for any reason, especially pain and discomfort, then your bigger movement muscles tend to join in. They brace, they spasm and tighten, and this causes even more pain. So Pilates is fantastic for working those deep postural muscles that are like our marathon runners of muscles. They can carry on forever as soon as we switch them on. They support the spine and it leaves the other muscles to move. This is Pilates. So, I'm going to describe to you the basics of Pilates today and activating these muscles. I'd like you to come down onto a mat on the floor. If you feel more comfortable on your bed, then this is fine, but you will find that your body is not supported quite as much. To come down onto the floor, make sure you have a chair next to you. This will support you on the way down and sometimes more importantly, on the way up. So take your position with the chair, use it to come down onto the floor if you need to. One knee at a time, sitting down to the side and lowering yourself onto your back. These exercises are sometimes done better with an empty stomach, so this is something to think about. Your Pilates positioning or your rest position is like this, with your knees bent. Think about your legs being in line like train tracks, hips, knees and feet, toes pointing forwards and nice alignment there. Good. Feet flat on the floor and just sense the floor through the feet there. Good. A nice place to rest your hands is just on the front of the hips, and we'll come back to this in a little bit. Lovely. So I'm going to correct you from the top down. It's extremely important, even the neck position, through the shoulders and the chest, even though we're working mostly around the middle. This is a complex routine of corrections of the posture. So if something is distracting you, some noise in the background or some family members or something, just recognize it and then try and draw yourself back to the movements. Lovely. So we're tucking the chin, lengthening through the back of the neck, broadening out through the front of the chest. Just be careful of all of that vascular access that you may have around the chest. Don't do any of this forcefully. Broadening the chest, drawing the shoulders down away from the ears. You can think about your shoulder blades on the back of the chest wall there, just pulling down gently along the chest wall. We don't have a good nerve supply from the shoulder blades to our brain, so we don't really know where they are. But if we're lying down flat on the floor, we can feel them. So draw them down. Think about tucking them into your back pockets at the back. This will pull the shoulders down away from the ears. Take a nice breath in. Breathe out and sink those ribs down. You'll suddenly notice the back of the rib cage coming down towards the mat, and you might feel that contact. Lovely. We want those ribs to sink down or melt down. We don't want to use those big outer muscles we talked about before to drag them down. These should be nice and relaxed at the moment. Let's think about the pelvis. I want you to do some pelvic tilts. Forwards and backwards, arching your back and then flattening your back. Your pelvis is like a bucket. If we were standing up, we'd be tipping water forwards and tipping water backwards out of the bucket. You settle halfway in between. You can feel just a little gap there. You could fit your fingertips underneath, but not your whole hand. That would mean you're arched too much. As you're doing these tilts, I want you to feel like you're keeping your ribs in position. This is dissociation. We're dissociating between the two areas. We're keeping one still whilst moving another. Once you have what we call neutral pelvis, that's halfway in between. I don't want you to get too stressed about this. This is not a minute angle. It's just not flat and not arched. It's somewhere in between. Tighten through your pelvic floor. Now your pelvic floor is at the bottom of our pelvis. It holds our abdominal contents in. So as we tighten through there, we get a natural tightening through our deep abdominals. That's your corset that runs around. The reason I'm getting you to do this is because we don't have the nerve supply from our brain to the motor muscles. So we can't tell them to switch on. We have to use another muscle group. So we tighten through our pelvic floor and we trust that this corset muscle is tightening. You can also feel for it using 2 fingers. Find your hip bones in a little, down a little, and just press in. As you tighten through your pelvic floor, you will feel a tightening underneath your fingers. Now, I don't want you to do this fast, like you would need to if you did a cough or something. I want you to think about an elevator, lifting from the ground floor to the 10th floor. We're going just to the 5th. So we're tightening and lifting, so we're not bringing them in too strongly. And we're doing it slowly as if rising up through an elevator. We do this because we don't want those big outer muscles to kick in, the six-pack or the obliques. The reason we don't want these is if they work and the abdominals don't, and the deep abdominals don't, then the deep abdominals will not want to work to support the spine. Lovely. So we tighten. Slowly, lovely. Once we've got that switched on, we can gently recheck the rest of the positioning. Chest open, ribs down. Neutral in the pelvis. Then we can start lifting our legs up to tabletop. So we peel up the right leg, coming up. Tabletop is shin level with the ceiling. That's like a tabletop. Bring the foot down. Common mistakes with this would be bringing the knee too far in or opening out too far there. So we're trying to hit that 90 degrees, knee above hip. Lovely. So we'll get a nice rhythm, lifting and lowering. Make sure you place your foot down with the toes pointing forwards in line with that leg. That sometimes needs a little check. So if you want to look up and have a little look, you can see that the foot is in line with the body. This is part of Pilates, knowing where your body is in space without having to look at it or check. You will notice my hand position. My thumbs are on my ribs and my fingers reaching down towards the pelvis there. This is a nice rested position to check everything is doing well. The important part of this exercise is when you place the leg down and then pick up the other one, the hips are not shifting. So having your fingertips on the hips can check whether they're shifting from side to side. If they really are, concentrate on pushing one foot down into the floor and peeling up through the other one. Push down gently, that activates through that leg and glute, and it gives you support to pick up the other leg. This is an important lesson to learn about Pilates. The leg that's on the floor, pushing down into it, activating, is the leg that's working. The other leg is just a lever to throw you off balance, to challenge you. Remember to breathe throughout these exercises and still to hold the posture through the upper half of the body. Lovely. So our next exercise in this position is lowering the knee out to the side and come back up. Throughout all of these exercises, just be extra careful of any abdominal ports that you may find get a little bit vulnerable with the leg movements and the pelvis. Just keep an eye on them. As you're lowering the leg out to the side and not dropping it, you're controlling the movement, nice and smooth. You're not trying to get the leg as far as you can, you're controlling it out without the hips moving. We still have that gentle tightening of the pelvic floor, which tells us our deep abdominals are switched on. You can use your glute a little bit at the side to lower the leg out. You can push down gently through the stable leg. Lovely. On the next exercise, we're going to slide the leg away. So let's make sure we have enough room here. So maybe come up the mat gently so that you have enough room to stretch the leg out. Recheck your positioning. Tuck the chin, open out through the chest, sink the ribs down, find your little arch in the lower back, tighten through the pelvic floor, and then slide the leg away.
Good, your foot can be flexed or pointed. I don't mind. The important part is when you change over, you push that leg down, the other one is free then to move. If you're frustrated by a sticky surface, you can have socks on a hard floor, or you could roll up your mat underneath you if it's annoying you. But you can gain a level of control by concentrating on the movement. Lovely. All right. The next position I'd like to make sure I teach you is on the side. So if you first of all roll your knees over, being careful of any vascular access around your abdominal area. And if you have a yoga block, this could be perfect for the head, or just a pillow. If you don't have anything, fold this arm to support the head. Lovely. I'm going to use that here today. Good. I'd like you to tuck your bottom arm backwards and your ribs and your hips. Scoop and tuck the bottom under, so you're curling your tailbone under. Push that top knee away. Good. Lift up your feet. Make sure they're in line with the body there. Lovely. Okay, always be careful of this underneath arm with the vascular access. And another alternative position could be to prop up the head in the hand there. Lovely, I'm going to stay in this position for purposes of demonstration. With all of those positions nice, you can lift that top knee. Just take note that once you've locked yourself in that good position, your knee will not lift very high. The aim of the exercise is not to get the knee particularly high. Your hip will rock backwards. So we're trying to keep the hip forwards and just lifting that knee as far as it can to that block. You will feel a natural block, embrace it and stop there. Lovely. We can do various things with this positioning, but this is the general position of the body to get the most out of your gluteus medius. This is your glute med, this muscle here. I don't mind the whole of the buttock area feeling like it's working, but definitely not the inner thigh, outer thigh, or definitely not into the lower leg. If you feel any of these things, first thing to do is go through your positioning again. Exaggerate some of that. Lovely. We're going to turn over onto the other side. You have permission to roll over if you would like and still just listen to my voice, but I'm going to turn and bring my legs to the other side. Take your time with these transitions of movement. Make sure everything is safe as you do so. Remember where you felt more comfortable with a block or pillow or head propped up. Push down through this top arm and tuck the bottom hip backwards. Tuck the ribs backwards. Scoop and tuck your bottom under. Push that top knee away. Good. And feet in line. Lovely. Lifting the top knee. Just taking note of any extra little adjustments you may need to make as you go. Brilliant. Relax your breathing. Have a little bit of tone through your lower abdominals there, just scooping in. As you go, relax this shoulder and embrace the fact that that knee doesn't lift up too high. That means you've got yourself in a good position and you're working the muscles correctly. And go at your own speed, of course. For me, these tend to be a little bit faster. I tend to replicate a normal walking speed. Lovely, let's do 5 more. 4, 5. Wonderful. Now coming up into standing can be a little bit challenging for some of you, so I'd like you to take your time with this and use whatever supports you may need. From here, you can come up to your hands and knees. Move yourself towards the chair. Put one hand wherever you feel is right. Step one leg up and step up with the other. Take your time with all of these positions. Maybe hold on to the chair briefly and take a few breaths just to make sure that you're not too dizzy. All right. So I hope you've enjoyed that introduction to Pilates. I hope it was informative and enjoyable. You can take all of those principles with you into the other workouts and into everyday life.
So take care, and I'll see you on your next workout.